Hi, good morning. Our group is going to present the 6-minute walk test, and it is a constant law of stress that measures the distance a person can walk in a 6-minute period. It is performed on a brick space on a flat and hard surface. This test is the simplest and most widely used test to assess a patient's functional capacity, and it is fast, low cost, inexpensive, and use an activity that is familiar to all individuals, that is walking. This test evaluates global and integral responses of all systems involved during exercise. Therefore, it doesn't provide system-specific information, nor does it determine the mechanism responsible for exercise limitation. What limitation we have to exercise? So we are going to do like a comparison of pre and post treatment or intervention of functional status. We have interventions like lung transplantation, lung resection surgery, volume reduction surgery, COPD, pulmonary hypertension, congestive heart failure, pulmonary rehabilitation. We have the assessment of functional status in COPD, cystic fibrosis, congestive heart failure, peripheral vascular disease, neuromuscular disorder, and elderly person. We have like the absolute contraindication for the 6-minute walk, that it is an acute myocardial infarction or unstable angina pectoris with the month prior to the test. We have another, it is like resting heart rate greater than. We have another one like resting heart rate greater than 120 beats per minute, and blood pressure at rest higher than 180. We have the absolute contraindication for the 6-minute walk, that is acute myocardial infarction or unstable angina within the month prior to the test. Another one, it is resting heart rate greater than 120 beats per minute, and blood pressure at rest higher than 180 and 100. We have another one, that is uncontrolled cardiac arrhythmia, and the last one, it is the lack of cooperation. We have causes for immediate suspension of the test, like precordial pain, intolerable dyspnea, a saturation drop below 86%, muscle cramps like staggering gait, dizziness or vertigo, and sudden pallor or diaphoresis.
Patient preparation. Comfortable clothing for the performance of the test. Appropriate walking shoes. The patient should use the usual walking aids in those cases that require aid, dogs, walkers, etc. Patients should continue their usual medical regimen. The patient should not have performed strenuous exercise 2 hours before the test. Reading expansion and signature of the informed consent form, which is specific for the 6-minute walk test. Characteristics of the site. It must be held indoors, flat and straight corridor, hard surface, low traffic, 30 meters. Distance must be marked every 3 meters. The start and finish line must be marked. Personal equipment and supplies required. Personnel with basic life support training, transit cones to the market return sites, pulsal oximeter, bore scale, oxygen source, Stiffy, no marica, ¿cómo se dice esa mierda?
Siga, o sea.
Chair for pre and post examination, resting, defibrillator, telephone, first aid kit with nitrates, aspirin.
And the instructions to the patient. You will perform a walk for 6 minutes. The objective is for you to walk as fast as you can to achieve the greatest distance possible. You will walk as many laps as you can around this market area. You will probably feel short or brave or tired. You are allowed to slow down, stop, and even rest if you need to. If you stop, you should restart as quickly as possible, and you should not talk at any time during the test, unless you have a problem. And if you have a problem, you will be helped immediately. Go to starting line and wait until I tell you that you can start walking. During the entire test, the examiner should be close to the patient. The examiner should never. During the entire test, the examiner should be close to the patient. The examiner should never be the guideline for the guide. She or he should be close enough to accompany the patient while keeping the necessary distance so as not to interrupt or affect the patient gait. At the time the test is completed, the examiner should assess the patient at the point of determination for dyspnea or fatigue with the Berg scale, oxygen saturation and heart rate, and then begin data recollection according to the starting protocol. If during the test the patient pauses, the determinated examiner can say, "You can rest against the wall if you prefer." Then continue walking when you feel up. Then continue walking when you feel ready. The examiner should not stop timing. They should not stop. Recording the data from the medical history of the patient requests the evaluation form. The items should be reprinted of the same day in the same place and under the same conditions. In order to same conditions, all in order to avoid additional variables. Practice tests, it is recommended that 2 gait tests be carried out, since the first one serves as the first of serves as an adaptation for the patient. The realization of second walk should be separated from the first one as at least 15 minutes. It is not possible to do the same day. If they cannot the following day, but respecting the same schedule of the first one to avoid the first circadian exacerbation of lung function pulmonary.